Joining us now is Dr. Atul Gogoi. He is the head infectious disease at Sir Ganga Ram Hospital. Thank you so much for your time. Dr. Gogoi, I want to start by understanding this. For several years, Dr. Gogia, for several years, we thought that, typhoid and stuff like that was a problem that existed in the rural centers where people were perhaps not treating their problem. But this time, there's a very peculiar problem in urban centers and people with affluent families or with more comfortable lifestyles or with RO purification at home are getting it.
Right. Good evening. Thank you for having me. I was just listening to you and you really highlighted it very well. So it's no longer a disease which is occurring in just the rural setting. In every day, in big centers like ours, we are seeing a lot of patients suffering from typhoid. And we, as you highlighted, that rightly so, typhoid is only happening because of fecal-oral route. So there has to be contaminated food and water which we are ingesting. So most of us feel very complacent that we have an RO or a filter at home and we cannot get, and a lot of patients would come up and say that they are only having bottled water. But we have to be very sure, as you highlighted, it's the raw, uncooked, undercooked food and the vegetables, the salads, and these also carry a lot of infections if not treated properly, in the sense that if not washed properly. So the water which you're using for washing also has to be
As important.
hygienic and clean water. That has to be clean water. So the best thing, actually the safest and the best thing, is boiling the water till the time we are able to get proper, ensure that we have clean water. Boiling water is the essential thing which can actually do away with this kind of a thing. But with the fads of having high food like salads and all, even when you're going out for a party or a restaurant or a wedding, people would pick up raw stuff which can get, and you are not sure of people who are cooking when there are large gatherings or when you're in a restaurant. So you cannot ensure the hygiene status and things like that when they are being mass production is there, and then the carrier status is there. Some of the people who are cooking may be harboring the infection, and which can be transmitted. So it's very, very important that clean water and properly cooked food, this is the main thing which we
Dr.
have to
Gogia,
think of.
help me understand then what is the best way to wash your fruits and vegetables, especially the fruits. Not everybody, the wastage of water that happens with RO, right? 40% of your
Right.
water is actually getting wasted in a country where, people don't even have access to it for, in most parts. So what is the best way to wash your fruits and vegetables?
So that's what I'm saying. When you don't have access to RO, or you don't, you want to prevent the wasting, boiling water is the best method. If you boil the water and you just, use that water for your regular use, in fact, also for cleaning, that generally would make things better. That's the simplest way, because that is something which all of us can do. You're cooking, so you can just boil the water for a minute or more, and you are able to ensure that the typhoid as well as other bacterial infections which are spread by this route also are taken care of.
Right. Another thing I noticed, Dr. Gogia, this time around is that typhoid earlier, and correct me if I'm wrong, used to be a disease that happened during the monsoons. This time in the winter, it's spreading. What could be the cause of that?
So the thing is, monsoons, we've always been attributing these things to the monsoons because there is flooding, there is a mixing of water, in the system of the drainage system. So that is the general thing which we've been seeing, because when there are flooding, water getting collected, so there is, the mixing of the mixing of water happening, and that generally was caused. But if you are not having access to clean drinking water and you are not ensuring these things, then definitely there is a surge in the typhoid. The other thing is, as we have a rampant use of antibiotics and things like, over the counter treatment people are taking. So we have partially treated things which are, making typhoid even resistant to the conventional
Ah.
antibiotics which we've been using earlier. Now you have to give, in a simple layman's terms, stronger antibiotics which are for longer duration. So earlier, 3-4 days, fever would break down with the simple oral antibiotics. Now you may have to upgrade to intravenous antibiotics and maybe give it longer, minimum 5 to 7 days it would take before the fever would break down. So
Got
that
it.
those are the challenges which are coming in now.
Dr. Gogia, I have last few minutes, but I quickly want you to highlight, before people self-medicate, what are the symptoms that they should check for and immediately think that it could be not just your regular seasonal flu or a flu-related or an allergic flu related to the pollution, that it could be something else. What are the symptoms that one must watch out for?
So very simple. Generally, if you think of simple viral flu, generally you would have upper respiratory symptoms like sore throat, running nose, cough. These are more like flu-like symptoms. So if you have high-grade fever, you have headaches, loss of appetite, abdominal symptoms, either constipation, diarrhea, bad taste, loss of appetite, which is lasting more than the usual 3, 4, 5 days. Generally the virals and the flus would settle down in 3 to 5 days, but something which is lasting longer than this, and you are having high fever, not coming down with your paracetamols or coming back, having headache, diarrhea, constipation, bad taste in the mouth. These are some of the symptoms which should make you think that you have typhoid, and one should do consult the doctor and get the appropriate test. And I would highlight one simple test. The blood culture is the only standard gold standard test which should be done. There are a lot of tests
Okay.
available which are being done. So that's the important thing. Yeah.
All right, Dr. Atul Gogia there, thank you so much for joining us. And here's hoping that people benefit from all this information and stop, self-medicating, and stop or also understand what the symptoms could be. It could be typhoid, it could be any other waterborne or airborne infection. We've got to stop, taking recommendations from our chemist. We've got to consult a doctor before we go ahead. Thank you so much for joining us on the
Thank you so
program today.
much. Thank you. Thank you.